time.
Okay. Well,
Wait, I have one question. Should I look at the camera or look at Lauren?
Look at Lauren.
Okay.
Okay. Very good.
Okay.
Well, welcome, Faith Mitchell.
Thank
good
you.
To see you. Good to see you since yesterday. Let's start at the very beginning and tell me a little bit about what brought you to the Institute. How did you arrive there? What were the circumstances?
I guess you could say I self-recruited to the Institute. So I came to UCSF to get my doctorate in medical anthropology, which was a joint program between UCSF and UC Berkeley. The people who had more public health experience were on the UCSF side, and those of us with a more traditional academic background were on the Berkeley side. So I came out of the Berkeley side. While I was there, I had kind of heard about Phil. You know, his name was in the air, and something Phil Lee, health policy. Then when I did my doctoral research in Jamaica, I kind of began to experience firsthand what policy might mean, because the Jamaican government was saying that they provided 98% of medical care in Jamaica, but what I was seeing on the ground was very different. Basically a lack of formal medical care services and people using a combination of folk medicine and drugs from pharmacies with not sufficient information to use them correctly, and then you know, some people were making use of the government medical system when it worked. So all of that experience got me interested in sort of policy. What is it? How does it operate in the world? And being an anthropologist, kind of how does the user experience sort of relate to these kinds of you know, guidelines and funding and so forth that governments are putting into place. So I had that question, and I also was pretty certain I didn't want to go into a sort of traditional academic anthropological track. So that led me to Phil Lee's door in the summer of 1980. And you know, Phil being Phil, I called him and said, I'd like to meet with you and sort of talk about my work and get some ideas from you. And of course he was open to that. And I spoke to him, let's say it was in like June or something. And then subsequently I saw Peter Bell, I don't know if that name rings a bell, who was running the Inter-American Foundation at that point. And I mentioned to Peter Bell that I was going to be talking to Phil, and he said, oh, tell him hi. So it was like, then the next time I saw Phil, I said, oh, Peter Bell says hi, and that kind of, you know, Phil. So that kind of got him even more interested. And he ended up offering me a job. Working, it was kind of vaguely defined, but he had money, you know, it was very Phil Lee. And he was working at that time with Milt and Mia on the book on pharmacy. Right, Milt Silverman on the book on pharmaceuticals in the third world or something.
Oh, right, the drugging of the Americans.
Yes, yes. So he said, well, you know, maybe you can do a little background work on that. And then he began to sort of cobble something together. This was before the Pew money came along, and it was even before the reproductive health money came along from Hewlett. So I did some work with Helene, and sort of gradually Phil defined a niche for us that had to do with teen pregnancy, both in the U.S. and overseas, because sometime in the early 80s, again before the Pew money, Steve Joseph, who was then at USAID, had approached Phil to say, is there a way to look at social marketing of infant formula and other kinds of products through USAID? And he was kind of interested, I think, in some of the ethical questions. So we got started kind of working on that, and then Steve Joseph resigned from USAID and went on to have a glorious career, I guess, in New York and other places. That kind of put a stop to that, but I think that's when Phil realized, okay, there's some, you know, some sort of international threads that we can begin to follow. Then fast forward to, I guess it was 1983 when he got the money from Pew to start the Pew postdoc in health policy. And he encouraged me to apply, and I was accepted as one of the postdocs. And that put me into more of a kind of an ongoing cohort of people who then, you know, attended conferences here in Washington and took classes and did things together for the next couple of years. But in addition to that, I also taught through the medical anthropology program. I taught a class on international health. And I also taught one that I called Race, Class, and Health, because we didn't even have the term health disparities in those days. And there was not really that much research because the HHS report on minority health came out, I think, in 1985, if I'm not mistaken, that really, really kind of put the issue of health disparities out on the table. And so we have a major problem in the United States. But, the signs were there, and my own experience in Jamaica told me that there's an issue here that needs to be explored and talked about. So that, in a kind of a nutshell, is an overview of my 5 years at the Institute.
Quite a trajectoria.
Right.
And so talk a little bit more about particularly your experience once you were brought into the Pew Fellowship Program, sort of about the fellowship experience and working with the fellows and the faculty, and then how that, might have influenced how your career has unfolded since then.
It was extremely valuable. For me, coming out of anthropology, I had had no quantitative training since high school when I had taken calculus, classes like that. And no exposure, in traditional anthropology to kind of looking at the world through a quantitative lens. So through the postdoc, we took classes in epidemiology. I took a class in statistics. It was very useful to kind of understand not only the techniques, the methodologies that were used, but then how they were used to kind of interpret data. And in my case, I think to begin to think about ways of combining kind of qualitative and quantitative techniques. So that was good. Also, Phil, just in the same way that I became a part of the Institute, the other Pew Fellows came from a variety of backgrounds, so that you got it was just very intellectually stimulating to be with them and to see there's all these different perspectives. There's Jamie Robinson using sort of health economics, and you have Jane Zones, who's coming out of sociology, and Sarah Samuels, whose interest is nutrition, and public health. So it was this multi kind of dimensional approach, which I found really kind of brought the topic to life. Comparing our Pew Fellows with some of the other programs, they seemed much drier in some of the other programs because they were more, I think, narrowly selected and their interests were more narrow. So that was good exposure. I learned a lot. And I would say I have applied things I learned from that period to everything I have done subsequently, because when I left the Institute, I went first to San Francisco Foundation, which was my first exposure to kind of policy issues in a very concrete kind of setting. Now you're at a foundation and you are funding policy-related kind of health issues in the community, and in some cases maybe even trying, funding data collection, things that were related to the policy process. I really enjoyed that because it enabled me to kind of put what I had learned in this more academic setting to practice. Then I went to the Hewlett Foundation, where we are now funding not, San Francisco is just the Bay Area. Hewlett is worldwide funding, working in a more defined area, family planning, but working on, even more on policy than at San Francisco Foundation. And then I went from there to the State Department, which was, a purely policy environment, great experience. And I think especially for somebody trained in research, because I realized that when you are an agent of policy, there is not actually much time for research. And not only that, but also that research, as I used to tell people, is just one voice in a crowded room. You have all of these other interests that come into play in terms of making a policy decision. And you remember Phil used to say, everybody needs a Washington policy experience, to work in policy. He's absolutely right, because then you just realize kind of what, what's at stake and how decisions get made, and that they're often not informed decisions or informed in the way that a researcher thinks they should be informed.
How
And
to
yet,
use and access information
yes,
quickly.
yes, absolutely. And then from the State Department, I went to the National Research Council and the IOM, where the mission, as you know, is specifically kind of bridging the worlds of research and policy.
Right.
And so even more so what you're saying, how do you make this, how do you present the best research to busy people who do not have research backgrounds in kind of quickly accessible, digestible, pragmatic, ways? You're working with these academics who could care less, in many cases, about what policy audiences need, and so
don't even realize that their work is policy relevant.
No, that's right. That's right. Or don't realize it, may not care, especially if they're some of the social scientists that we worked with. I think the medical people are more interested in being useful, but some of the
More applied from the beginning.
yes, some of the social scientists have information that could be very valuable, but their career tracks don't require that they ever make that connection. And so again, kind of pulling on things that I had learned and using my skills from the Institute days, either kind of implicitly or explicitly, to make these connections that we're talking about to inform the policy world.
When you talked about the Pew Fellowship experience, one of the points that you made was that it was really great to have the dynamism that comes from having people from different disciplines, bringing them together. And that's, in part, the essence of the Institute, is this multidisciplinary entity that fosters and encourages collaboration. So move from the fellows themselves, in a way they gave you that experience at a micro level, to being embedded in an organization that has that as one of its defining principles.
I think it may well have been a unique experience for a qualitatively trained person like myself, because there are not that many places where I could have been kind of embraced. And
I'm sorry to interrupt, but you tapped the microphone, so just there aren't that many places.
Okay, there aren't that many places, I think, for myself as an anthropologist where I could have been embraced and incorporated so fully into the work without question, because it was multidisciplinary when I got there. And as you and Peter were saying, it was really kind of the heyday of the Institute. People were coming on board, everybody seemingly from a slightly different background. And the kind of ethos of the place was, let's find ways to work together. Let's be connected. So let's recognize and kind of incorporate the qualitative aspect of this question, as well as, say, the quantitative element of it. I felt completely respected and able to kind of, what would you say, develop my ideas. And as I was saying, I'm not sure there weren't that many places where I would have been able to do that, to find ways in a way to be an applied anthropologist, looking at issues of health and health status and medicine, without a sense of being a second-class citizen. That the economists were there, just picking on them because they're often the people who try to dominate, the discourse. The economists were there, the docs were there, the nurses were there, and yet I think because, and I would attribute this to Phil, people felt like they were on equal footing. Lou Butler as a lawyer,
Right.
Al Johnson as an ethicist, you just had all of these different dimensions mingling in this really rich environment.
I don't know if you ever had the experience, but I can remember going up to a meeting with a multidisciplinary group of people in the medical school, and everybody was either an MD or a PhD, and Phil introduced each person as, this is Dr. Faith Mitchell, so that he put everybody on equal footing, even in an environment where there was an imbalance in terms of status between the MDs and the only PhDs.
Yes, only a PhD, yes.
Right, exactly. So talk a little bit more about the other unique, if you can think of any, unique attributes of the Institute that, stick in your mind to this day that make you think it was a special place, and then more broadly, the value added of the Institute and the other institutes that have developed since it created the model. To the whole sort of, policy and policy research environment.
Okay, starting with another unique, or at least a strength of the Institute. Well, I can think of a couple just came to mind. One is the fact that, I thought of three. Okay, so one is the fact that everybody had access to Phil's Rolodex. And of course his Rolodex had all the movers and shakers in the country in it. I can remember being, say a year out of graduate school, and Phil would say something like, I've got Joe Califano on the phone, want to talk to him, And again, it's partly, it's testimony to Phil that you would feel like, wow, he feels like I have something to say to Joe Califano, so he elevates you, by lifting you up to his level and treating everybody in this very equal way. Similarly, you might remember how Phil would bring people in who were, say, between jobs, but on their way up in the world, and so there was this sort of unpredictable and constant exposure to all kinds of interesting people. I'm thinking of the guy who ended up running the Medicaid program in Arizona. I can't think of his name. Yeah. And they were still like sort of putting the program together, and Phil gave him a desk down in the basement with the rest of us, while he was waiting. And so you got a chance to sort of talk to this person who otherwise you might not have any contact with, who's on his way to sort of fame and fortune elsewhere. But aside from that, the fact that although it was a soft money institute, and although in some sense it felt like Phil was sort of making it up as he went along, he had, high standards and inculcated those standards to people like myself who were, fresh out of graduate school, about the importance of publishing, the importance of peer review, the importance of getting funding, so it was even though it was a non-traditional environment in some respects, it was very traditional in others. And I think that that's part of what's reflected in the careers of the people who came through the Institute, as well as in the body of work that the Institute itself produced. You asked me to talk about institutes. When I was at Hewlett, we funded not health policy institutes, but demography centers. And so just thinking about what's the value of those kinds of concentrations. Clearly they allow for a body of knowledge to be kind of systematically developed. And I think in an area like health policy, it really, Phil and other institutes that followed obviously just helped put that on the map, created a body of knowledge, gave it credibility and weight, produced studies that could be taken seriously by people in Washington or people at the state or local level, showed that these kinds of analyses are of value as we design health services. They have something to say. So they really created a field in the same way that GIH created a field of health philanthropy. The Institute, I think, brought something into being that had not existed before, and that will now not go away, I would assume.
Right. What kind of advice would you give to somebody who was sort of on this track, or at that sort of the point you were at when you were in your graduate program and trying to figure out, is there a life for me, when I'm not, I don't think that I want to go down one of the most obvious traditional paths. And both, what kinds of sort of situations they should seek out, and then, what that would mean for them career-wise. I didn't say that very well.
Right,
you know
right.
What I'm saying.
Well, I think, one of the lessons that we're saying you could take away from a place like the Institute is we know that especially when you're talking about health status, medical care, that these are issues that affect they're very human. They affect sort of every aspect of people's lives, and that you don't get the right answers by working in silos, by segmenting the questions, I don't think. You know, one of the things that I liked about UCSF that was reflected in the Institute, but to some extent, you know, was beyond the Institute, was the fact that it was an interdisciplinary campus. You know, people were working together. The med-anthro people were working with people from other fields. You have, you know, the people in health psychology, Nancy Adler and others, working with other folks. So that just seems like there's a lot of that sort of cross-fertilization that happens at that campus. I would say to a young person, look for a place that is like that, where people are kind of understand the issues well enough and are intelligent enough that they realize they need to communicate across fields and to look for the commonalities in whatever the question is that they're working on, because that's where the best answers come from. I mean, that I've seen that from my work at the National Research Council, the IOM as well. Those are deliberately multidisciplinary groups because you need all of those different perspectives to really come up with the best solutions to problems. So I would say do that. Find if you can, a place that is kind of on its way up, that has a lot of energy and dynamism and creativity, because that's what's going to stimulate you and kind of nurture you to, you know, be similarly, I think, creative in your own career. One of the things we were saying off camera that I'll repeat is that it's remarkable when you look at the people who were, say, at the Institute in those first 5 years when I was there, the people that I know from that period, people have gone off on so many different pathways since then, but they all reflect that concern for health policy in different ways. People are doing all kinds of interesting and important work. But it's very different from, say, a traditional department, I think, where everybody is kind of, you know, people are in much more predictable kinds of subsequent paths. You know, it's just been very creative in that respect.
Well, let's move, since you mentioned the people. Let's talk a little bit about the people. First, clearly you've said a lot about Phil, but talk about the leadership of that first cadre of faculty members. You sort of mentioned a few of them earlier because they were all multidisciplinary, but how that sort of what role you think they played in defining the culture of the organization and how that played out in different ways in daily work.
Well, and as you point out, the leadership itself was multidisciplinary. So I'm thinking Lou Butler, the lawyer, Phil, the physician. You had Hal Luft, a rising leader there, health economist. Al Johnson, maybe not a main leader, but I think of him, he was there at the house down the street, and health ethics. So they literally kind of embodied the fact that good policy work requires lots of different perspectives, and then they were leading seminars, and they all had kind of an open door. You could go talk to any of them about research you were working on or questions you had. So that, to me, that's what the day-to-day life and work reflected, that it was just this rich environment, many different interests, people who had made their marks in various fields who were now all kind of come together literally in those houses, and the fact that they were houses kind of underscored the sense of family. I think I probably didn't even appreciate it as much at the time, you know, as I did later. It's when you get later in other environments that you realize what a very special place it was, and the way in which, you know, Phil is writing articles with different members of the leadership. They're writing articles with each other. So again, kind of bringing those joined voices to the different questions that they were addressing.
And I know that you have kept up close relationships with some of the Pew Fellows who you mentioned, but talk more broadly about connections with others at the Institute, and whether you've kept in touch, sort of how you view the broader swath of people that we worked and lived with at the time.
Yes, I have tried periodically. Thank God there's email. And of course, when the Institute was dedicated as the Philip R. Lee Institute in 2007, that was a great homecoming to see everybody together. But I've at GIH we've invited former Institute people to speak at meetings. So we continue to interact professionally.
And current Institute people.
Right, as well as kind of socially. I have funded people. When I was at Hewlett, I was funding the Institute, in fact, and funding Claire's work. Claire and I have also written things together. So again, I think that's testimony to the fact that not only, I guess, to the quality of the kind of work we were doing, the training we were getting, the fact that people who came out of the Institute were able to move into sort of leading positions and to continue to work together in that respect in different ways.
Well, we're sort of coming to a close, so please tell me anything more you want to make sure gets into this historic record, or if there's a question I didn't ask you that I should have, this is your opportunity.
I think I've said everything.
Okay, great. Thank you very much.
I didn't want to start babbling about something.